Good evening. My name is Melissa Silva, and I'm the Executive Director of the Mental Health Association, and we would like to welcome you here tonight to this great event. On behalf of MHA and our co-sponsors, the East Baton Rouge Parish Coroner's Office, LSU School of Social Work, the Capital Area Human Service District, and LSU, welcome and enjoy this night tonight with us. MHA is very grateful to our co-sponsors because without them tonight we could not make this event possible. We have heard it overwhelming from our community that the need for this dialogue on mental health and this crisis in our community must be held. We're all here tonight to educate ourselves and each other on the current mental health services available, the gaps in those services, and any potential crises, any potential solutions we may have. We are very excited tonight that we have people present that work daily in the trenches in our mental health services in our community that can help to inform us as well as facilitate this much needed dialogue. In a few moments, you will have the great opportunity to meet our panel, but I would like to at least introduce just some of our distinguished guests that are here tonight. Mr. William Daniels, which is our Chief Administrative Officer of the Mayor's Office. We have Mr. Wesley Church, the Director of the LSU School of Social Work here tonight, who's one of our sponsors. With our special session tonight, and was also with the storms that passed through our areas last night, some of our senators and legislators could not be here. Senator Beau Cassidy was not here tonight, but he did send a few recorded remarks for our audience.
Hello, I'm Senator Bill Cassidy. Many of you know I'm a physician who's worked in the public hospital system, and in the public hospital system, in any medical system, there are many who are mentally ill. You and I share that experience of caring for the mentally ill. Let me tell you what the Senate is attempting to do to reform our mental health system. The Mental Health Reform Act of 2015 would help family members care for mentally ill loved ones, encourage mental illness education and awareness, potentially impacting the lives of 44 million people in the United States who suffer from mental illness, and even more who are their family members. In fact, all of us, because society itself is affected. If the Mental Health Reform Act of 2015 succeeds, it'll be because the Senate and the House, the Congress, understands that mental health is an important issue. We put together this short video for you, which goes into more detail about this legislation. Thank you. We've got to do a better job on the issue of mental health. And I use the example, there's a price we pay for not doing so. And one example of that price is the terrible thing that happened in Lafayette at the movie theater. And just introduced the legislation, and we're hoping that we can get it passed. As public servants, we should seek to keep the public safe. But our mental health system is badly broken and fails to do so. And reforms are coming too slowly. It doesn't make sense that parents caring for a mentally ill child cannot be part of the medical decision-making that could prevent horrendous tragedies. The last 4 or 5 years I've been working on mental health. Chris Murphy from Connecticut, where they had a Newtown shooting, has been interested in this as well.
But there's no doubt that by increasing capacity, you're going to make it less likely that somebody's going to walk into a school or a movie theater who's very sick and cause this kind of damage.
The federal government spends a lot of money on mental health, but it spreads it around for things that are less effective. This takes that and concentrates it where it can do the most good. Where that person who has their first problem with mental health can then have the services that she or he needs so that they don't kind of spiral downward but return to being well again. That's the goal. We need to take what's already being spent in the federal government and spend it more wisely and more effectively.
So it takes to expand access. It asks states to report their outcomes. Now, if a state's doing a really good job, the hope is that other states will imitate what the one is doing, which looks so good. There's also grants in which we expand the number of mental health providers. Right now, there's an incredible shortage of mental health providers. So there will be an attempt to increase that number.
And our whole goal is to take someone who's young, who may have had a problem with mental health when they were 18 years old, and give them the services that they would need so that they return to mental health, true mental health, as opposed to beginning a process where they continually get worse. We have it on both the House and the Senate. We think that we're going to have both Democrats and Republicans. We think there's a good chance it can be signed into law. So this is neither a right nor a left issue. It is an American issue. And we think we can find rationale for it both from the patient's perspective, the family's perspective, but also the societal perspective.
Thanks for watching. The Mental Health Reform Act of 2015 is important, but will only succeed if its importance is recognized. Thank you for recognizing this importance.
Not only are we excited about to have our experts here tonight, we have some mental health consumers and some concerned community members that will give some testimonials tonight. Ms. Shafonda Hamilton is a former inmate of the Parish prison and also a consumer of Capital Area Human Services. Shafonda, would you like to come up?
Hello, here. How's everybody? Good. I'm just so grateful to be a part of this. I'm so happy to see so many people involved in an issue that's very important to the community. I'm so with Senator Bill Cassidy. You know, if somebody would have helped me at 18, I would have continued on the down spiral and ended up in prison. But I am so happy to see Warden Grimes. You just have such a pleasant face on this side of the But I am a testimony in the fact that when I got involved with Capital Area, because I did reach 100 miles also on the inside, that this works. If we come together as a community, if the stigma is removed and replaced with compassion, it works. I'm ashamed of things I've done, but I am so looking forward to the future. And again, thank you, Dr. Jan Kasofsky and all the staff at Capital Area, Mr. Steve Aguilar, all of the wonderful faces. I mean, this is just a wonderful experience to be a part of. It's good to be here. This works, and with the continued involvement of concerned citizens, it will make our community better. We won't have what we've had, like the young lady that ended up being shot at, a few days ago or some days ago by her cousin accidentally. Things like that we can prevent if we catch it early. So I'm just glad to be a part of this, and thank you.
He's also a consumer of mental health services, but he is the director of our Bridges program, which is a community-wide, statewide program that offers education and support to those suffering with mental illness. Jeff.
Good evening. Good to be with you all. And it's encouraging to hear stories like yours. I've worked with the Mental Health Association for Greater Baton Rouge for 8.5 years now. And it has been a struggle to find myself even after graduating from college and being a product of 12 years of public school. During high school, I was diagnosed with obsessive compulsive disorder. And I didn't realize at the time what a huge impact that disorder would have in my life. I'm 43 years old, and to be sure, I've made a few strides. I've been almost at a standstill in other aspects of my life. And so I think what a lot of mental health consumers, including the ones that are unfortunately get caught up in the criminal justice system struggle with is, who am I? What do I do? What direction do I go in? What does this mean, these symptoms? And how do I address them? In a healthy way without using dangerous substances or using dangerous coping strategies. It's a continual journey for me, one that I'm still on. Thank you.
Many of you may know Miss Jerry Hobby. She has a son that has suffered from issues with mental health, and she's also become a great advocate for those in this community that suffer from mental health. Jerry?
Good evening. I'm here representing a lot of mothers who share the same story with me, but I'm one of the fortunate ones. I did the best I could to raise my children with home, good experiences. They worked hard, I worked hard, I was doing all the right things. But one day, my son decided to join the Army, and he went off, and he came back and he wasn't the same. He tried to get help from the VA. There was some. A lot of pills, but he wasn't getting the help that he needed. He started sofa surfing. You know what that is, a lot of y'all? Friend to friend, bouncing around, on and off medication. And I tried to get him home. I would try to arrange to take him to have breakfast so I could talk to him about coming home. And one day, he seemed real resolved. And I said, well, maybe he's doing better. But then again, I had a little experience with trauma. And I knew something was wrong. I knew that there were some signs that said you need to look out for something, because he was so peaceful. I was going to work a few days later, and I walked in and I was ready for my day, and I got a call from an old friend, and she said, how are you? And I said, I hadn't spoken to her in 10 years, and I was like, well, I'm glad you're calling, but she said, are you sitting down? And I said, no, what is it? And she said, are you watching TV? And I'm like, I'm in my office, I'm working. And she said, turn on the TV. I didn't have a TV, so I went online and was able to see video that was captured by a student at an apartment complex near LSU. And I was able to watch my son pleading with police to kill me, please shoot me. Many of you know in the field that for some reason, soldiers think there's more honor in being shot by someone in uniform. That was his intent that day. There were a number of policemen around, guns drawn, but they didn't shoot. 3 seconds. They didn't shoot. I was lucky. And I was lucky because, thank you, Jerry. Many of these officers and many I got to meet, and a year later or so later had crisis intervention training, because our community knew enough and had leaders who knew that it was important for our law enforcement officers to understand the disease and to de-escalate rather than to shoot. And because they didn't shoot, I have my son. Now, he's had challenges. He's going up and he's going down. And I will say additionally, and he spent some time in jail. And I keep thinking, if that center was ready, if that center was here, my son would probably be a college graduate today. he would have had an intervention because there would have been a jail diversion where he would have had an assessment perhaps and had some other options other than looking at a felony. So, I've always said this anytime I talk and there's officers present and Warden, I know you understand, and other officers present, that I know sometimes that trigger may be pulled. And that's unfortunate because we don't have the services to prevent our family, our children, ourselves from getting into those situations. The treatment, the money isn't there, but the people who care are here. And we can make that happen. This community can make that happen. I don't care who funds studies. They're done. We know what we need to do as a community. And I implore you to join all of these wonderful people who are investing their time, talent, and treasure and making whatever we can do to support the needs of those suffering with behavioral health and substance abuse. Co-occurring disorders receive the help that they need. We can do it. We have to do it. And I want to thank Jan, my first call, Jan, my second call, Tanja, Dr. Udofa, who was there to support me through all of this, because it's not just the individual, it's the families. Because when your child, your friend, your husband has it, your life changes forever, and you know that. So thank you to everyone here who's working to remove the stigma of mental health illness and help us understand as a community that those of us with behavioral health challenges can be contributing members of this community if we have a little bit of help.
Addiction. When the Mental Health Association was incorporated in 1954, it was started because we wanted to advocate and educate those with mental health issues. Over the years, we've expanded to provide services to this community as well as working with families to provide them the education how to better take care of their families. 2 years ago, there are some questions that were submitted by our attendees before the event, and there will also be a chance for folks to ask questions in the audience tonight as well. Ms. Lilley?
A way to join us too, to help that every penny that we currently have or will have will be used in the most productive way to address the mental health issues that we have. So the first thing we're going to do is I'm going to introduce Dr. Kasofsky, let her introduce what her role is, and then we'll go down and introduce, and then I'll let Dr. Clark start on this side just to introduce yourself, then we'll start with a question. Yes, you can stay seated.
Sorry, the first one here. Is this on?
Yes.
Okay. Hi, it's great to see so many of you come out. We have a lot of work ahead of us. Everybody knows that. I'm judged here, you know that. It is a pleasure to do the work that I do in this community. I've worked with so many of you in this room, and you really make a difference, and I know that your heart's in it. And we just have brilliant people who want to get this done. And I thank my son and Beau for putting this together. But I represent, I would say, the public sector on mental health, addictive disorders, and developmental disabilities. My agency's name isn't real catchy, Capital Area Human Services District, and you hear capital area and you think of window cleaning or yard service, but you know, we see about 14,000 people unduplicated in our clinics every year. And it's really a pleasure to work with the people that I work with and to serve this community. I know that everybody continuously hears about budget cuts that we get hit with, and they are true, but I think the most unfortunate thing is that although it's good you know that we're under stress, that we're constantly challenging ourselves to do more with less, we are open for business. And I think the most disturbing thing that I hear is people think that we're not available anymore. And about 3 years ago, we moved to something called open appointments. And it was modeled after a program that the Kaiser Permanente did in California, that we see people the day they come in. And so if you come in, I know it's early, and I know that you might wait 3 hours if you aren't part of the system and have an appointment, but you'll be seen that day by a licensed clinician. You may not see a physician, you may not need to see a physician, but you will be seen that day. And so I just really want to urge you as professionals who do talk to people that we have the true sliding fee scale. There are people that come to us that don't have any ability to pay, and we have a pharmacy. And I think that it's critical that we make sure that we help people get to where they need to go and help eliminate the stigma that prevents people from coming to get what they need. We have been cut twice already this fiscal year. The third cut was passed the House Appropriations Committee. I don't think that it's going to stay the amount that it is, but if it goes through, it will mean that just for this year, we'll have been cut over $700,000. And for next year, the cut that they told us to work out is over $4 million. And so we really need to be diligent about what's going on here. When they take away the state general funds, we've been very blessed with the fact that we deliver a good service. So people who have insurance, people that don't, everything in between, people come to capital area, and we're collecting the amount that we're budgeted to collect. So that way by state general funds, we are competing with the private sector. I'll come out and say it. And I'm proud of the fact that we have excellent physicians, nurses, social workers, psychologists, peers, and we continue to work very closely with the LSU School of Social Work. I think we're the biggest placement. We have Our Lady of the Lake nursing students coming through. Residency training program.
I am so sorry, I'm going to have to stop you.
So anyway, okay, so we are open for business.
We're going to let you talk again then. We're going to let you talk again. We're just going to introduce.
My name is Aniedi, Udofa, I'm the medical director of the capital area. Just now to what Dr. Kasofsky talked about. We've been very blessed in the capital area that we have several psychiatrists, board certified, working with us. We have 9 full-time psychiatrists, 3 part-time. We also work in school. We have services in 32 schools, 3 adult clinics. We have clinics in 7 parishes, so the clinics in all those parishes. We have not just covered there. And so, like I said, we have a walk-in service. If you have to see a psychiatrist that day, you won't see a psychiatrist, especially if it's an emergency. You do not allow anybody to walk away if there is a problem. A psychiatrist is very hardworking. The walk-in services truly allow us to see more people for the fact that it cuts in on a no-show. So instead of just having this appointment with people that are coming, we're able to see a lot more people, and we're out there ready and able to see as many people as possible.
Thank you so much.
Yeah, and we have scheduled appointments also.
Very good, thank you.
As you heard earlier, my name is Jeff Hinlgle. I work with the Mental Health Association of Greater Baton Rouge. We have 3 main programs. One is called the Alliance House Residential Center, and it helps mental health peers that also have substance use disorders to hopefully get their lives together and get jobs and become productive members of the community. We also have a drop-in center for adults with chronic severe mental disorders, and it gives them a place to go for friendship, to learn, for structure, to develop their artistic and academic sides. So we're very proud of that program. And lastly, we have a program called Bridges, which is statewide. We contract with the Office of Behavioral Health. It's a peer support and education program run by mental health peers for peers throughout the state of Louisiana. So we're very proud of those 3 programs and awareness functions like this one.
Thank you.
My name is Jan Ross, and I'm with the Huey Foundation. And it is a privilege to be representing the foundation. But I also have a connection with mental health and my board position. I am on the board of, previously on the board of Baton am on the board currently with the Capital Area Human Services. I'm so sorry. That's great. Capital Area Alliance for the Homeless and the Capital Area Reentry Coalition, and also on the board of kindergarten through 12th grade school for the Baton Academy. And all of those have populations where they serve people that are with the foundation, back in the early 2000s, Christians created their focus, and the focus areas on our giving is in human services, education, healthcare, including reentry programs. And their goal was to provide funding that would help all citizens of the greater Baton Rouge area to be as productive as they can be. And so the grant awards that we award out each year are investments that we make into the community, trying to assist people where they are and trying to get them to be as productive as possible. This year, we have created a prison reentry initiative, and that is focusing on creating a continuum of care, starting from when someone is first incarcerated and working with them through multiple stakeholders that we fund, but working towards helping those people that once they're released remain a productive citizen. Oftentimes, these people are the older and unresolved issues that have caused them to be incarcerated. So in that respect, we continue to be supporters and providers of mental health associations, those that are helping individuals that are accepting mental health.
Just a minute.
Corner. I know a lot of you say, what does the corner have to do with mental health? I'm usually the guy that is known for investigating why people die or how they die. We do that about 3,000 times a year. We have 3,000 death investigations a year. I do have two other jurisdictions. One has to do with the collection of forensic evidence in sexual assault cases. That's about 300 cases a year. But my largest jurisdiction has to do with mental health and mental illness, which is the involuntary committal of the mentally ill. These are individuals who may not quite know that they need help, may be a danger to themselves, a danger to others, which is either recognized by someone in our community or another healthcare provider. And we ensure the safety net so that those folks that may not know they need help, we can get them the help they need. And we do that we have about 9,000 mental health investigations a year. So it's 3 times as much as what I'm really kind of known for. So.
Good afternoon. I'm Warden Dennis Grimes, Warden at the Parish Prison, and we basically go through a lot of mental health every day, dealing with those that are brought into the Parish Prison for being arrested because there's no one else to take them. Our level of medication given out takes us 4 hours now through every pill pass because we have more inmates that are on medication than we ever had. Our population is a lot more sicker than it ever has been. We are being influenced with a whole lot of mentally ill individuals that are coming in that shouldn't be in jail, should be somewhere else instead of prison, and prison is not the place for them. But we have set some guidelines and some things in place to try to help with the mentally ill and take a more pro approach at looking at it and trying to have some ideas and some resources to help. We've brought in, since I've been there in the last 8 years, we've brought in working with Capital Area, we've brought in more social workers, more peer supporters, trying to have more groups going on so that we can actually deal with it and basically get some resources going so we can help them. Not only just in prison, but to help them when they get out, so they can know the resources that are out there. So we're taking an approach to try to do that. If we have somebody that's 6 months, or we have them at 6 days, we want to do whatever we can to help them and to get them on their way. We also ask for help from families that we do get sometimes, because when we get somebody in, we try to find out the background of that person that was in there, what triggered them to get to the point to where they are, if they're on some kind of medication, to help them speed on and get them back on their medication, find out what they're on, so we can make sure that we can get that medication for them and get them back started on. So definitely we need the public help in doing what we're trying to do, and just because of the close of mental hospitals, we knew we were going to be innovative with all the mental health people. We knew that. And so it was kind of a rush thing being put up on us, and so what we had to do was revamp what we've been doing, start training out officers in CIT and mental health treatment. So they'll know how to recognize it. Instead of problems being a disciplinary problem, it can be a medical problem. It's a mental health problem. And so we've learned to more train them every year. So they get 40 hours of training, dealing with crisis intervention, and trying to deal with it. But we still have a long way to go. Thank you.
Good evening. My name is Patricia Clafee, and
heart and compassion, and I think sometimes when it is criminalized and that you miss so much of that, and so I am so glad that this all came to fruition in this time. So we're going to jump in the deep end with one of the questions that was submitted, and so I'm going to ask the question that I'm going to give each of the panel members a few minutes, maybe about 2 minutes to respond. I am so sorry, but as not moderator, I will have to kind of shut you off to move to the next person. They voted that. I did not volunteer, but I was voted for that position. I don't know what that says about me, but I will stop you. But I'm going to ask you the question and give each person, if you as a panel member does not have something maybe to add to that, you do not have to. We'll go to the next question, and we're going to open it up for the audience too. So the first question is, what do you see as the most critical issue regarding mental health in our community, and how do we address this issue? I'll start with Dr. Clark first.
Okay. So I think it has to do with acute crisis would be the most pressing issue. Currently right now, what I see from an involuntary perspective, these are folks that may not know that they need help, certainly need a place to go. And oftentimes that decision matrix may end up being jail, which isn't necessarily the right place. And I like to give the following example, which is if you had chest pain and you called 911, they wouldn't sit there thinking, well, should we take them to the hospital or should we take them to jail, right? They would take you to the hospital to get medical care. I feel the same is true if you have a mental health issue, the jail is
having their rights taken away. And I think that the people that I've spoken to that have had to go to the hospital because they didn't have a choice, it's a very difficult thing to deal with during the time and then after the time. It's the only time, as an American, you actually lose all of your rights. And it's a very difficult thing to go through for families and that individual. And I just always come back to some wonderful statistics that we have here in Baton Rouge. I don't know how many of you are aware, but we did open a program at Earl K. Long called the Mental Health Emergency Room Extension. So we've got wonderful statistics to show how people will use an urgent care type center for their mental illness, just like you would with having a physical urgent care need. We saw that 40% of the people that used that center came on their own, without law enforcement help. About 50% of them, they did come with police or sheriff's deputy, and then about 10 probably ambulance. We don't really know what that other 10 was, but in the 2 years it was open, 3,600 people were treated there. Not one of them was discharged to jail. We saved the state $20 million in hospitalization, acute hospitalization, and we went from 100% being hospitalized down to 32%. So we had a model that works, and you can look at the model that BRAF unveiled on Monday. You can go back to the model that the design committee did. It will be effective. We know it will save money, it will save people's lives, it will help prevent them losing control or having their rights taken away from them. And so, you know, those of you that know me, I'm not a social worker, I'm a trained biochemist. And I can break anything down into a really good question before I answer it. Well, we had the question, the community came up with an answer, and we had the data to show that what works. And I really just pray that this community can get back up there and handle this in a very inappropriate way. It's just, right now, it's a shame that officers are being put into the situation that Ms. Hoppe talked about. If you don't think that's hard for them to make that decision, It's very hard. If you don't know what people who work in prison medical have to go through when they don't have the resources, especially the medical personnel, the nurses, and they can't get to provide the service because it's not funded, it's not set up as a mental health hospital. It takes a lot out of everybody that's involved in it, and we want to do it right. So please, when we get a chance to support a center being open in this community, we need to make it happen.
Yes, definitely, we do definitely need a mental health stabilization unit. It is helpful for everybody to see as psychiatrists. If we allow our person with mental illness to really kind of lose complete control, a lot of times some bad outcomes might happen. It becomes more of that the person could become a little bit more dangerous or to something that they would not have done under normal circumstances. And so we, as a public, we do need that help. We need to be able to help people, we need a little more empathy, a lot of education. We always encourage family members, watch out if there's any sign of your person not right, because as a family member, you can tell when the person is having a problem. They're just not right, they don't look right. As much as possible, you can try to seek help, even if it's just to go to a primary care doctor, at least to talk to them and see what you could do. It is always helpful if you can at least start doing something at that level. There are a lot of people that would, I guess, things like, well, I don't have insurance, I don't have any money.
And I won't go into that too much, but I tend to think that the root of the problem is the problematic thoughts that people have that in turn create problematic feelings, which of course lead to problematic behaviors, and then problematic outcomes come from that. Unfortunately, these outcomes they're tried to remedy in unhealthy ways, illegal ways, more crime is produced. So, as a peer supporter, I try to model sound thinking. I'm not always the most rational guy, but I did major in philosophy. So, at the root, if you're not thinking the right thoughts, you're going to have a lot of problems in life. That's all I'll say.
For me, as to critical issues, I kind of look back at back in the mid-'80s when there was such a public push of deinstitutionalizing. And once people were released back into their community to care for their family, there was a growth and continual.
I think your microphone goes in and out. You may want to hold it a little closer.
There was a greater and a growing dependence on governmental funding to continue the care. And as we've seen, and as we're going through today, those funds just aren't here any longer. And so that pushes the communities more and more to take on the care of their citizens, of the people that are suffering with mental illnesses, so that they can receive the care that they deserve and to be treated very humanely, just as we would want ourselves to be treated. And so from my perspective, it's that less dependence on outside funding and taking the mentally ill into our community and making sure that they.
So, I heard this week on the news, there was a new program from the Area Foundation to create some mental health services. If I have an adult chronic mentally ill child, how will this help my loved one? So I guess we'll start with you, since I think they need BRAF.
Yeah, I think they do too. Well, unfortunately, this center is for adults, and we have had conversations with
people who work.
Now, this CAHS is an adult chronic mentally ill child.
Oh, child, I heard child.
It's adult.
To receive for the report that was issued shows that every year our coroner is issuing more and more and more commitments. So those commitments are steadily on the rise. That suggests that in a crisis, that's the vehicle to care. So we're trying to provide alternatives to that, so that that one system isn't as inundated. Also, we got some information from Our Lady of the Lake about the emergency room used for people in behavioral health crisis. And there were a number of the people from a sample that they suggested could have gone to this center as opposed to the ER. Jan?
Well, right now, my advice would be to contact that person's mental health provider. You know, the center's not up and running, but the first thing is, Jerry has said, and other people have said, is family members, hopefully you're in touch with your family member. I mean, that is another problem too, is people with mental illness and substance abuse, sometimes their behavior gets them into trouble with their own families, and I know some of you in the audience have been through that too. But if they're lucky enough that they're still part of their family and the family's involved, is that you don't wait until it's an emergency. You don't wait until it's time to see the coroner. You have a relationship and you get them to see their mental health provider. And whether or not they have one, if it's a first time issue, when people are acting strange, don't try to rationalize things. You know people around you, you know your family members. If things are going wrong, you don't wait until it's an emergency. And I would say, if they don't have a primary care provider, you get in touch with them and say it's an emergency. So you don't get to the point of having to call the coroner and you and they go through such a really difficult time. But I think everybody needs to be understanding of, and that is within a very short time period, they started closing beds up at East. And I think about 200 people, I know there's someone in the audience that knows the number, people that have been institutionalized for maybe up to 30 years, where they were put into the community, and supports were provided to them initially, and the thought was that they would be able to handle their medicine, and they would handle their groceries, and taking care of themselves and paying rent, keeping track of their appointments, finding a way to get to their appointments. And for many people, they weren't able to do that. But once they were deinstitutionalized, they had the right to refuse treatment. And so we have that issue. This community was absolutely stunning after Katrina, with the number of people who ended up being cared for, all of us in our homes and in different facilities. But the fact of the matter is so much housing stock was lost in New Orleans that will never be available to people who don't have a decent income. So people started to come to Baton Rouge and stay in Baton Rouge, and many of them are in unlicensed group homes. So on one hand, we've got a blessing that people are being housed. On the other hand, they're not getting the supervision that they would normally get, maybe in a place that has someone on site that was overseeing meals and things like that. So there are things that happened in Baton Rouge. And then additionally, in the past, before Katrina, 70% of the people that left acute hospitals for a psych stay would end up being released back into the New Orleans area from all over the state. Well, it flip-flopped after Katrina. So now 70% of the people come from all over the state to Baton Rouge following the hospitalization. So that is why it's very important we understand what brought us to this crisis. We lost the Baton Rouge General's emergency room, we lost Earl K. Long emergency room, and we lost the end here at Earl K. Long. So it puts a large burden on the existing emergency rooms, causes a backup for police.
So the first question is, what do you see as the most critical issue regarding mental health in our community, and how do we address this issue? I'll start with Dr. Clark first.
Okay. So I think it has to do with acute crisis would be the most pressing issue. Currently right now, what I see from an involuntary perspective, these are folks that may not know that they need help, certainly need a place to go. And oftentimes that decision matrix may end up being jail, which isn't necessarily the right place. And I like to give the following example, which is if you had chest pain and you called 911, they wouldn't sit there thinking, well, should we take them to the hospital or should we take them to jail, right? They would take you to the hospital to get medical care. I feel the same is true if you have a mental health issue. The jail as being an option shouldn't be one. It should be an ability to take you someplace where we can manage your acute crisis.
That's an interesting question.
Well, we worked on it just for you.
One thing I would say, first of all, is that the jail is not the place for bringing them to the prison. I think most of it is the fact they're catching it early on and being proactive early and dealing with it early before it gets to the point that it's at that point. A lot of times, what we experience in dealing with most of them is some of them are self-doing it, self-creating entity. Because when we get them, you go back and look at it, that this is something that didn't start when they were 30, 40 years old. But this is stuff that was started when they were 15, 14, 15 years old, but nobody really addressed it. Just come up with solutions and problems and saying different things, but really didn't address the issue that was there. And so now we're at the point now that we're trying to address those issues with the wrong method, and that's prison. I think that's not the way to do it.
Yeah, I agree with the warden. I think that offering options when people are starting to show signs and symptoms of an issue, think about if there might be someone who is having an issue, their family member feels scared, doesn't know what to do, they might call law enforcement or the coroner and they say, we can't do anything until they get so sick to where they're going to hurt someone or themselves, but they know something is wrong. And yet there's, outside of calling the regular doctor, maybe a capital area or someplace like that, there's no 24-hour place where the public and law enforcement can turn to as an alternative to that person then staying in the community and getting sicker unless they're able to see someone. So I think offering something early on when they're still at that lower level of acuity, and then the outcomes are definitely better.
I think everybody hopefully got a lot out of what was said. It's complicated, right? I think everybody would agree. I feel a bit overwhelmed. I don't know about you guys. I certainly think that maybe this is kind of what people maybe that suffer from mental illness or their families might feel, like we all feel right now. It being complicated, us feeling overwhelmed. So to make a complicated issue simple, I think two things that I would take away from tonight's meeting. Number one, this is a medical issue, and we treat medical issues by treating them medically, not treating them in jail. Secondly, I think that it's a multifaceted approach. I think it's important to recognize that there are several things that we need to accomplish in order to help our entire community. One would be peer support, like we discussed earlier. Another would be people that are on the verge of crisis, like BRAF is presenting in their recent document here. How somebody who might be near that crisis moment, how do they get connected, how do they get help? The third thing is people who are in crisis, that voluntarily know they're in crisis or are going to ask for help, and we need to get them that help. And people who are in crisis that may not know they need help. And that's where I come in as the coroner to help them in an involuntary mechanism. And I think Jane gave us an excellent example of what we already know has happened in our community successfully at OK Long previously. And lastly, I think, is what do we do with the chronic long-term issue? Obviously, we've had the deinstitutionalization of mental health in our community. There are no longer these long-term beds. They're difficult for people to find, and so we need to figure out a solution for that as well. So looking at this spectrum of things that we have to accomplish, and certainly it's complicated and overwhelming, but I think if we break it down into those four entities, that we can kind of eat this sandwich one bite at a time and not choke on it. So thank you all for being here. One more minute. Thank you.
Certainly on behalf of the committee, the Mental Health Association, we so appreciate it. one of the things Melissa said, and you can come up if you, I don't know if you have anything else to say, but May 3rd, at the Capitol, one of the things that Jan said about getting out, May 3rd is Mental Health Behavioral Health Awareness on the Capitol. What a great opportunity if it would be a mass of people out there to say, because one of the things that get legislators' attention is numbers of people who vote, and to say it's enough and we need the help. So May 3rd, mark your calendar to be at the Capitol, and I'll let you close this.
We just wanted to thank you again for coming out. This is such, Dr. Clark said this is such a vast issue, and we can break it down. There's still a lot of questions that we did not answer tonight. I'm sure there's additional questions that you guys have. One of the things we talked about, we heard a lot about family and what can we do as family members for our loved ones. So I think that's a next good step for our conversation and another dialogue in terms of the services. We enjoyed you coming out tonight. If you have any further questions, a couple of us will be here for a few minutes longer, but thank you. Good night.